Good afternoon and welcome to Webinar Wednesday. Today we are joined by Heather Martin, Director of Business Development at TechNation Associates. Webinar Wednesday, we would like to thank our sponsor TKA. TechNation Associates is a healthcare technology management company which is owned by health systems and built by clinical engineers with great depth of experience. TKA is privately held as an operating company within the Economic Development Group of the Innovation Institute, a healthcare incubator owned by 6 non-profit health systems. The Innovation Institute employs more than 300 people and generates over $200 million in revenue to support innovation from its equity owner health systems. Together, the operating companies of the Innovation Institute have to date managed more than 1.5 billion of clinical equipment in US hospitals. For more information, please visit ii-techno.com. Just a reminder about our Fall MD Expo. We're headed to the Mohegan Sun Casino and Resort in Connecticut from October the 8th to the 10th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more information and registration details, please visit mdexposhow.com. I'd also like you to mark your calendars for our HTM Mixer, which is being held at the Marriott Resort Griffin Gate in Lexington, Kentucky in November 15th and 16th. Now, our mixers are a slightly modified, smaller, shorter duration and less crowded event, but still provides valuable continuing education, networking, and vendor engagement opportunities. So for more information about the mixer and registration details, please visit htmmixer.com. Okay, today's webinar is eligible for 1 CE credit from the ACI, and for any nurses attending, this webinar is also eligible for 1 CE credit from the California Board of Registered Nurses. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's webinar by giving away one of our Webinar Wednesday 10th anniversary prizes. Today's prize is a pair of Apple AirPods. So using the questions feature on your dashboard, let me know the answer to the following trivia question. September is National Chicken Month. What is the name of the founder of the Kentucky Fried Chicken restaurant chain? I'll reveal the answer and our winner at the end of the webinar. As I mentioned earlier, our presenter today is Heather Martin, and she will be discussing a nurse's perspective, building trust in mobile equipment asset management across departments. So Heather, you may begin whenever you're ready.
Thank you, Linda. I did want to say hi on camera, but I am going to go ahead and present the rest of this off camera and come back at the end for questions. I'm really excited and pleased to present our session today. Like Linda shared, my name is Heather Martin, and I am the Business Development Director for TechNation Associates, also known as TKA. Today's topic is close to my heart, and I'm excited to share insights that I believe will resonate with everyone involved in hospital operations. Whether you're a nurse, a clinical engineer, or part of any other department in the hospital, understanding how to build trust and foster collaboration can enhance patient care and streamline workflows. In this webinar, I'm going to draw from my personal experiences to explore how effective communication and teamwork can lead to more effective equipment management and better patient outcomes. My goal is to provide you with actionable strategies that will help improve coordination, reduce equipment-related stress, and create a more cohesive and supportive work environment. So thank you for joining me. I hope you will find this session both informative and inspiring. Let's dive in and explore what it looks like to achieve excellence in better patient care through better equipment asset management. Our agenda today, we'll look at an overview of my experience and relevant background in nursing and equipment asset management. We will define trust and consider its significance in the healthcare setting. We will gain insight into the daily challenges nurses face with equipment management and its impact on patient care. We will explore how equipment management challenges affect various departments within the hospital, not only nursing, but clinical engineering, supply chain, and more. I will introduce the Ready Plus program and share how it addresses equipment management issues. I will provide a brief overview of the RTLS tracking software that we use and discuss its role in enhancing equipment management. The last topic will be about fostering collaboration and trust between departments to achieve that unified efficiency we all desire in equipment management. And finally, we'll open the floor for some questions. So to give you some context, let me start with a bit about my background. Yes, I graduated during the time famous for big hair, and let us not forget those iconic nurses' caps. Thankfully, I never wore this cap again after graduation day. I've spent over 30 years immersed in the healthcare setting. My journey began at the bedside, where I worked in a variety of hospital departments, including pediatrics, med-surg, perioperative, and infusion centers. I'm a military wife, so I worked in hospitals in several different states across the East, moving every couple of years to a new place. To be honest, this frequent move probably helped me to become more resilient. As an often scared new staff nurse, I faced the usual challenges as best as I could. But eventually, with hard work and thick skin, I grew more comfortable in my role and advanced to a seasoned nurse manager. About 15 years ago, I made a significant shift from direct patient care to the business side of healthcare. I took on a role as a healthcare account executive, representing a leading equipment life cycle company. In this role, I spent significant time inside supply chain offices and biomed shops, selling and renting peak need medical equipment and the maintenance and management services surrounding that equipment. Because of my frontline experience and desire to see beyond the crisis management of peak need rental of equipment, I was part of the team that implemented mobile equipment management programs in several area hospitals where I lived. These programs were quite successful in improving the availability of patient-ready equipment for nurses and clinical engineers, and to get them out of the business of managing equipment on their own. This time was a great joy for me to deliver a best practice environment and see the hospital caregivers thrive. After that, I spent several years representing a food service software company that focused on optimizing food, nutrition, and retail operations. This experience taught me that the effectiveness of technology, or the success or failure of that technology, is largely dependent on the people who use it. I was excited to join TKA a couple of years ago, where I found I have come full circle in offering equipment maintenance and management programs. Our goal is to improve the workday for clinical engineers, nurses, and all hospital staff as it relates to equipment maintenance and management. By improving operational efficiency and the financial bottom line, we strive to make a meaningful impact on patient care and the healthcare environment. Through the years, I've had the unique experience of seeing both sides of the fence, or the big picture. I've gained a deep appreciation for the passion and dedication of everyone involved in healthcare. I've seen firsthand how crucial it is to build trust between departments and foster a better work environment to improve patient care. Well, let's start by defining what I mean by trust. Trust can be described as an assured reliance, confidence that something is dependable and will perform as expected. It's the belief that when we rely on a process, a tool, or a person, that they will meet our expectations and deliver as promised. In a fast-paced hospital environment, the breakdown of trust can have significant repercussions. When trust in systems or processes falter, it can lead to problems and workarounds that complicate workflows and strain resources. Often, issues arise not from negligence or someone's lack of effort or care, but the need to adapt quickly in the absence of reliable processes. I mean, we got to check off those boxes and move on to the next task. In healthcare, trust is particularly crucial. It's foundational to providing quality care. When there is trust in our systems, processes, and of course our coworkers, it directly impacts the level of care we can offer to our patients in a positive way. On the other hand, a lack of trust can lead to frustration, hinder teamwork, and very likely negatively affect those patient outcomes. So, what are the tangible benefits of building and maintaining trust? First, transparency and visibility become much easier to achieve. When we trust that resources are managed effectively, we reduce the need for workarounds and improve accessibility. Second, trust enhances collaboration. It fosters a unified team environment where resources are readily available and frustration is minimized. Building trust isn't just about creating a positive environment. It's about ensuring that processes are efficient and patient care remains the priority at the highest possible standard. I do want to walk you through what a typical day looks like for a nurse. Having been in the field for as long as I have, I can tell you that it's both complex and demanding, and it's helpful to understand these challenges to appreciate the need for effective solutions. My typical day would start out with getting my patient care assignment and report. Usually it was a heavy one and included conducting patient assessments, administering medications, and providing various treatments. I needed to approach my patients with both skill and compassion. Coordination of care is another key aspect of the job. Communicating with practitioners, families, and facilitating care between different departments to make sure every patient receives the comprehensive treatment that was ordered by their physician. Documentation is essential too. I spent a significant amount of time maintaining accurate and detailed patient records. Keep in mind that when I started my career, it was all paper charting. I lived through the transition to electronic health records. I did find this exciting, but it was a huge shift in our practice and a roadblock for many of the staff that I worked with. Meticulous documentation is crucial for continuity of care and compliance with healthcare standards. It could be very hard to achieve this with the constant demands for your time. Throughout the day, the interruptions were frequent, and these disruptions impacted my workflow. Managing admissions and discharges added a layer of complexity, as I needed to care for both new and outgoing patients and my current patient load. Emergencies were another challenge. Handling deteriorating patients or those in severe pain required immediate attention, which would pull me away from other important time-sensitive tasks. Administrative visits, including Joint Commission surveys, would at times interrupt the routine. Staff issues such as call-ins or addressing disgruntled patients or families further complicated the day. With staff shortages, you could expect the workload to increase significantly. Managing a high number of tasks with limited staff was stressful and often led to burnout or a toxic work environment. Often there was no time for lunch or bathroom breaks, which only exacerbated your frustration, fatigue, and feelings of overwhelm. So yes, nurses are notoriously given a reputation for hiding and hoarding equipment, not to mention the time they spend, precious time they spend for hunting for equipment. So with resource shortages, I would find myself searching for equipment, moving from room to room or floor to floor. One shift still haunts me today. I needed to improvise by getting equipment from the less than ideal location, the soiled utility room. I did the cursory wipe down and set the equipment up, justifying that what I was doing was the best I could under the circumstances. This was not my proudest moment. I knew coworkers that kept spare equipment for their own use, creating a sense of competition and frustration. Yes, I have the stories of IV pumps in lockers or hidden in drawers, and the times that we found equipment tucked behind the ceiling tiles. There were times that stealing from other units that had staged equipment for their anticipated needs seemed like a reasonable option, not considering the domino effect that it created. Eventually, I transitioned from a staff nurse to manager, and this offered a new perspective. I gained insight into the broader operational and financial aspects of healthcare. I'm sure you're wondering how that happened with all this bad behavior I'm admitting to. While I never lost sight of the challenges I faced as a staff nurse, this shift allowed me to move from a reactive role to a proactive one, seeking to improve practices and enhance overall efficiency. One of the critical areas of concern was infection control, as now I was the one auditing the staff. Shortages of properly cleaned or sanitized equipment could lead to violations and compromise patient safety. Rental and purchase decisions became something I had to consider. Deciding whether or not to rent or purchase equipment involved evaluating our department budget and ensuring that resources are available without having excessive costs. Looking back, I saw the need for better solutions. I felt then, as I do now, that a more efficient workplace is a happier workplace. And without a doubt, that will have a positive impact on the patient. Fast forward to today. I am proud to be part of Technology Associates, TKA. We're a key player in a unique network of organizations. TKA is one of 10 companies owned and operated by these 6 nonprofit health systems, collectively known as the Innovation Institute. So why is this important to share? Well, as part of the Innovation Institute, TKA is deeply connected to the priorities and challenges faced by hospitals and healthcare systems. Our ownership structure means that our goals and strategies are closely aligned with those of our health system member owners. Being a part of this network allows us to hear directly about the pressing issues and evolving needs within the healthcare sector. This firsthand insight gives us a compelling perspective so we can better support hospitals and healthcare systems. In fact, last year, the Innovation Institute conducted a survey of 1,200 nurses from our member health systems, titled Reimagining the Work of a Nurse. The results were strikingly resonant to me. They highlighted that the challenges I faced over 30 years ago remain pertinent today. Specifically, role strain persists as a significant issue. Nurses feel overwhelmed by numerous tasks that detract from their core desire, making a meaningful human connection. Our survey highlights critical challenges faced by nurse executives. Retention of bedside nurses is a major issue, with many struggling to find purpose amidst the stress and moral injury intensified by the pandemic. The increasing difficulty of the environment has made it hard for nurses to stay motivated and committed. The nursing staff faces unprecedented stress, leading to a rise in verbal and physical assaults. This intense pressure has contributed to a record number of nurses leaving or planning to leave the profession. Nurse executives are actively working to implement positive changes. They are collaborating with frontline staff to address these issues. Key initiatives include nurse governance structures, professional development programs, and well-being initiatives aimed at enhancing job satisfaction and support. Feedback reveals pertinent frustrations, like excessive time being spent in documentation and how it detracts from patient care, or the challenges in accessing necessary equipment quickly add to stress and reduce effectiveness. Efficient resource management is crucial and something we can definitely do something about. Nurses need to perform at their best and at the top of their license without the added burden of locating and managing equipment. Reliable processes and technology for immediate equipment access are essential to reduce nurse burden and improve patient care. The goal is to redesign the workplace strategically to support nurses both professionally and personally. By addressing these challenges and implementing effective solutions, nurse executives aim to improve patient care and support nurses in excelling. Now let's explore how these challenges in mobile equipment asset management affect some of the other departments within the hospital and the broader implications of these challenges. First, let's consider the impact on biomedical technicians. They often face significant difficulties in locating the equipment required for preventive or corrective maintenance. This challenge can jeopardize compliance with Joint Commission standards and disrupt maintenance schedules. When technicians spend valuable time searching for equipment, it's essentially time wasted, leading to delays and potential compliance issues. Not to mention, inadequate equipment management can result in staff using improper cleaning practices, like I've admitted to, which may damage equipment and impact its overall performance. The supply chain department faces strain from frequent equipment requests, which can lead to renting or over-purchasing. Over-purchasing ties up capital, while renting can become costly and inefficient. Both of these issues point to deficiencies in inventory management and create inefficiencies and stress within the supply chain team. Effective equipment management is crucial for the infection control and quality departments, which are responsible for patient outcomes and performance indicators such as readmission rates, hospital-acquired infections, or HCAHPS scores. Inefficient equipment management can lead to lapses in infection control, negatively impacting quality of care and performance metrics. These issues can undermine efforts to maintain high standards of patient safety and satisfaction. C-suite executives are also affected by equipment management issues, by unplanned equipment downtimes and throughput issues, which can increase operational costs and strain the hospital's budget. Equipment-related disruptions can impact overall productivity, patient satisfaction, and employee morale, potentially leading to long-term financial difficulties and operational disruptions. Finally, poor equipment management affects every department within the hospital, highlighting the need for effective mobile equipment asset management. Addressing these challenges will improve overall hospital efficiency and improve patient care. Okay, so I'm excited to introduce TK's Ready Plus program, a solution designed to transform equipment management within the hospitals. Let me walk you through what Ready Plus is and how it can make a significant difference in daily operations. Ready Plus stands for reliable equipment, available, disinfected, and inspected. Reliable equipment, meaning that Ready Plus ensures that all equipment is dependable and performs as expected. You can count on it to function correctly when you need it the most. Available means that our system makes sure that equipment is readily accessible and in patient-ready condition when it's needed. No more delays or last-minute searches. Disinfected. We take cleanliness seriously. All equipment is thoroughly cleaned and sanitized according to manufacturer's recommendations. If you're familiar, for instance, with the cleaning specs of the Alaris pumps, there are different solutions required on different areas of the pump and a specific 15-minute dry time for the connectors. Inspected, meaning that regular checks are performed to ensure that the equipment is in proper working condition, fully charged, the drug library is up to date, there's no overdue inspections or recalls. Compliance with these inspections is meticulously documented, so you can trust that everything is up to standard. Room service for nurses is the way we like to refer to Ready Plus. It simply simplifies equipment management by providing a streamlined, dependable service. After all, who doesn't appreciate a little room service every once in a while? Our commitment to proactive management is evident in our equipment rounds. Ready Plus staff make regular rounds throughout their shift with a stocked cart in tow. They use real-time location systems, also known as RTLS, to check on soiled utility areas and par levels. This ongoing oversight ensures that equipment is always where it needs to be, reducing the chance of misplaced or unavailable items. When it comes to order fulfillment, Ready Plus ensures that equipment requests are processed efficiently and promptly. If a patient requires specific equipment, Ready Plus staff step in to make sure that it's delivered when needed. For critical areas like the ICU or the ED, We would maintain a predefined PAR level to guarantee immediate access to essential equipment. In patient units, our system ensures that equipment is delivered to the room or the PAR level within a 30 to 45-minute time frame, with a small PAR level kept on hand for urgent needs. On the operational front, TKA provides hands-on management through our leadership team, working closely with hospital department heads to provide seamless integration of our services. We align our processes with existing hospital practices to create a best practice environment. This close collaboration helps our solutions fit perfectly into your current workflows, making the transition smooth and effective. TKA's Ready Plus isn't just a game changer for nursing staff, but it's an asset for biomedical technicians. We often talk about the room service for nurses, but it also provides the same level of service for techs too. Ready Plus simplifies access, and managing mobile medical equipment becomes a breeze. Instead of spending valuable time searching for equipment due for PMs, techs can focus on core maintenance tasks. Consistent equipment availability with Ready Plus decreases the need for nurses to hoard or hide equipment. Resource management, where visibility and accountability of equipment location fosters increased trust and cooperation. This simplifies the day-to-day job for the tech. TKA's RTLS through TeamNet provides complete visibility into equipment locations, improving asset management and workflow. With Ready Plus equipment tracking, specific location of devices with open work orders can be viewed on handheld devices and dashboards or pulled into reports, improving responsiveness and workflow. The Ready Plus team will offer support by delivering clean PM due equipment to the biomed shop on schedule, helping maintain reliability and reduce downtime. Again, TK Ready Plus leadership would provide detailed reports, participate in monthly joint reviews to ensure that compliance with standards. During joint commission surveys, TKA can represent equipment management issues, helping to address any concerns or questions that might arise. TKA Ready Plus supports both nursing staff and biomedical technicians by optimizing equipment management and enhancing operational efficiency by reducing manual tasks, making the job easier and improving departmental performance. So TKA's RTLS tracking software powered by TeamNet plays a central role in the TK Ready Plus program. This technology is truly the backbone of our equipment management strategy, and I'd like to highlight how it enhances operations and supports goals. Using Bluetooth Low Energy, TKA's equipment tracking provides accurate real-time information on device locations. There are a variety of tags, or some people call them beacons, available, depending on the needs of the hospital or the size of the equipment. Locators are strategically placed on patient units, exits, and barrier stop locations to effectively manage equipment movement. This transparency helps to eliminate the common issues of equipment being hidden, hoarded, or misplaced, ensuring that everything is where it needs to be. It uses both active and passive scan. For passive scanning, tagged equipment sends the signal. Locators receive the signal passively every few seconds. This information or data is continually collected and updated in the RTLS application, providing ongoing visibility of equipment location in real time. Active scanning, the RTLS uses barcode technology for more active tracking. Using a handheld device, staff would actively scan a barcode on the tagged equipment, and then they can tie specific tasks or actions to the scanned device. By selecting statuses such as equipment is being cleaned, or equipment is sent to biomed shop, or equipment is on the PAR, clean ready condition on the PAR level 12. These actions are tracked and recorded in real time, giving more detailed data on equipment usage and status. So the data collected in the RTLS application can be viewed on a mobile device or a dashboard on your laptop. This flexibility ensures that you have access to the data you need whenever and wherever you need it. Everyone knows how to follow someone on social media. Well, you can follow specific devices in the RTLS application. One great use of that functionality is if devices are due for PM but currently in use on a patient, a tech can follow these devices and then be alerted when it is placed in soiled utility so that the device can be retrieved and picked up and for their PM. Rental reduction. By tagging rental equipment, RTLS helps reduce unnecessary rental fees. You'll know exactly what you have, where it is being used, and when it was discontinued from the patient. Loss mitigation. By placing locators at exits or barrier stop locations, the system assists in tracking and preventing equipment loss, helping avoid costly replacements. Capital planning is always a goal of mobile equipment asset management. The goal is improved productivity and utilization of the hospital-owned equipment. Data from RTLS can aid in future planning based on the collected information. Battery life management. RTLS monitors the tag battery life, ensuring timely replacements, thus keeping the RTLS in operation and improve your ROI on using the system. RTLS streamlines equipment management processes and reduces the time spent on manual tasks. Most importantly, RTLS builds confidence among nurses and biomedical technicians. When equipment is available and accurately tracked, it fosters that trust environment where everyone can focus on providing that best patient care environment. So these next few slides represent some of my favorite RTLS functionality. Just know that we're just scratching the surface of the capabilities here, but certainly these slides will show you how this technology can bridge the gap and offer transparency to equipment location for everyone in the hospital. So this screen shows open work order maps using the hospital's specific blueprints. The colored circles show the location of the selected category of devices. This screen represents the integration with CMMS, the system that manages the maintenance information for the clinical engineering team. By toggling over here at the top, the open work orders, the circles light up in red to show that there are devices with open work orders in that area. To the right of this screen is a list view of those devices with details about those individual devices, including the actual date the PM is due, and other device information as well. You can further click on each individual device in that list, and it will open up yet another screen that drills down with everything you ever wanted to know about that particular device. This is an exciting updated feature with the system. This shows the centralized monitoring dashboard and offers a great opportunity for multi-site systems to track multiple device statuses, including open work orders, open corrective maintenance, battery statuses, etc. It also allows you to navigate between different sites, eliminating the need to have multiple windows or screens open at the same time, thus streamlining workflow. This screen represents a PAR track view. This shows what equipment is in the soiled utility room that needs to be picked up, cleaned, and processed in real time. If it's a wound vac, is it a rental? Does it need to be discontinued and returned to the rental company? Wouldn't it be nice to have an entity in the hospital that is responsible to follow rental equipment and discontinue them in a timely manner? RTLS tags can be placed on rental equipment and followed, like I mentioned, and tracked for usage when treatment is completed, called for pickup, which obviously stops the rental billing and reduces rental spend. This screen also shows here at the bottom PAR levels that are fulfilled to the whatever rates that you have, the parameters that you have set, and that they're in this certain areas the patient-ready equipment is available. If the PAR level drops below that parameter that you have set, it will show up in red. The Ready Plus staff would then address those requirements on their rounds. This highlights that dedicated people using technology is what drives a best practice environment. Patient throughput is a big issue, and at the heart of that is transport and wheelchair availability. Whether it is nursing staff or a dedicated transport team moving a patient through the system, knowing where you can find a wheelchair can make the difference of a smooth process or a disaster. This transport map screen shows wheelchair tracking and mapping that reflects the real-time location of wheelchairs. Talk about a game changer. I mean, mind-blowing. But this might be one of my favorites. This tracking equipment protocol screen shows equipment protocol compliance and offers visibility to whether a device has moved through a device-defined hospital protocol for cleaning and processing. This particular IV pump started in sterile processing here up at the top. It moved to a clean storage shelf, and then it was placed on a patient. When they were finished using it, it was placed in the soiled utility room and then back to sterile processing. It shows the amount of time the device spent in each location, and this represents that a protocol was properly followed. But if that same IV pump went from one patient directly to another patient without going to soiled utility room or the sterile processing room, that is out of compliance. If a device does not follow a protocol set up in the system, this protocol violation can be set up to land on a report or even alert sent like via text or email to infection control or unit manager to view and track who they need to coach on compliance within the hospital protocol. This can be shown to Joint Commission on how the hospital is addressing infection control compliance. This is a powerful management tool and would absolutely affect change in behavior. So finally, TKA's Ready Plus program, our goal and mission is to build trust and enhance collaboration between departments. TKA offers 3 distinct levels of services, each designed to address specific needs within hospitals or health systems. Each service contributes to creating a seamless and efficient healthcare environment. Our programs, TKA's HCM or equipment maintenance, TKA's Ready Plus mobile equipment asset management, and TKA's tracking with RTLS through TeamNet can be customized and combined to create a comprehensive solution tailored to meet the hospital's specific needs. The ultimate goal of these programs is to meet the unique requirements of your organization, enhancing operational efficiency, improving patient care, and fostering that collaborative environment where both clinical and technical staff can thrive. By customizing our solutions to the hospital's KPIs, not ours, we aim to deliver optimal results and drive meaningful improvement in equipment management and overall hospital operations. In the demanding and complex world of nursing, where patient care, coordination, documentation, and interruptions are constant, nurses should not be burdened with equipment management. TKA aims to transform this landscape with a program designed to build trust and foster collaboration between nurses and biomedical technicians, achieving unified efficiency that benefits everyone, a true win-win-win for patients, staff, and the bottom line. By streamlining mobile equipment asset management, TKA allows nurses to focus on exceptional patient care and perform at the top of their license without the stress of equipment-related issues. Our Ready Plus program ensures equipment is reliable, readily available, clean and inspected, eliminating the need for nurses to search for, hide, or hoard resources. Through efficient inventory management, comprehensive reporting, and optimized service programs, we reduce costs, support better capital planning, and enhance patient care. Our approach not only addresses equipment management, but also alleviates burnout, improves staff satisfaction by seamlessly handling equipment concerns, With TK's solutions, we bridge the gap between operational efficiency and frontline care, creating a collaborative environment where both nurses and biomedical technicians can thrive. This commitment to unified efficiency ensures that highest quality patient care while delivering benefits across all areas. Like I said, it's a win-win-win. So thank you for joining me today. I hope this presentation was helpful. I would definitely welcome an opportunity to collaborate and hear from people in the audience with comments, ideas, specific requests. Please reach out if you'd like to learn more. Here's my contact information. And, have any of your questions answered. I do think we have some time for questions. Let me see if I can put my...
Yeah, well, a few have come in, Heather. So yes, we've got some for you. So the first one that has come in is you mentioned RTLS and its use in equipment tracking. Are there any other applications that your solution can be used for?
Absolutely. So once you've had the maps, the locators mapped to your hospital units, exits, etc., there are other applications depending on what tags you use. So the tags can be the temperature. You can track temperature and humidity in the pharmacy, in the OR, the blood bank, the lab, etc. You can there's staffed arrest buttons now that are being in development. So if the staff is in any kind of trouble, they push a button on their badge so you can track staffing concerns, hand washing tracing. You can do contact tracing or time spent in the, say you want to track how much time someone has spent in the OR holding room or the ER waiting room. You can hand them a tag so you can track people. And you can track other assets, any other assets in the hospital that you want to be able to manage the movement. So sometimes we'll get requests for IT asset tracking. So those are some of the possibilities.
Super. So do you have to use your CMS in order to get the open work order feature?
So TeamNet's CMMS system has been in many high profile accounts for over 25 years, with the RTLS added in the last 4 to 5 years. So it's ideal to use the TeamNet CMMS system with the TeamNet RTLS for that obvious reason that it's the same program. But you do not have to use our CMMS. We would be able to build the integration through an API. And did I click out of the... and the same, we would be able to do the same open work order integration through an API that you would get through the TeamNet, but it would have to be built.
Perfect. So, okay, here's one. How can you really trust that nurses will stop hiding or hoarding equipment?
Very good question. Yeah, it's hard to believe that anything would get them to stop doing that because they, but it's totally a trust building experience. So implementing a new program to me needs to have someone from nursing involved in the planning phase and the implementation phase. I think that the program, any kind of new protocol that is presented should be done with fanfare, where everyone knows it's coming. There's a specific go live date. There's a new process now. This is how you're going to get equipment that you need. This should be clearly defined. There should be no surprises. It's really interesting that when in preparation for that day, leading up to that day, how they suddenly release or, give up the hidden equipment that they've held onto because they would happily not have to deal with it, in my opinion. And so that's my recommendation. If you might find equipment that you thought was lost for a long time, if you really involve nursing and you make a big deal out of that go live day.
Okay, perfect. Now, before we wrap up, I've got a question here is, what is one thing you wish you knew when you first started your career?
Wow. I would share that I think I had an idea of what nursing was going to be like, and it wasn't what it actually was like. And so I would have wanted to know that eventually I was going to get through those rough times, and there was a really incredible opportunity, like the world is your oyster. So I think that I started my nursing career in school thinking it was going to be one way. I started my career and I think I was actually in shock for a little while about how much harder it was than I thought it was going to be and all the demands. But fast forward to today, I mean, nurses can do just about anything, and that's really exciting. So I think get the experience, take the experience, and try to make it a better work environment so that ultimately patients are better taken care of. Because it could be your mother, it could be your family member that's in the bed. So I just think it's an impact, it's a job with impact, and it's an exciting career. So I wish I knew that.
Perfect. I have got a couple of questions, Heather, but I'm going to email them to you so
Okay.
you can answer them offline. Okay, I'll do that
Yep.
directly afterwards. So thank you, Heather, for your time and for a great presentation today. I'd like to encourage everyone to visit TKA's website to learn more about the services they provide to the industry. So please visit ii-techno.com. Now, as promised, the answer to today's trivia question is Harlan Sanders, or more commonly known as Colonel Sanders. So congratulations to our winner, Christy Edmonds in North Carolina. So enjoy your AirPods, Christy. Now, just a quick reminder, you can obtain your C certificate by completing the post-webinar survey, and this will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI or the California Board of Registered Nurses, and you will be able to download the certificate directly from your computer once the survey is submitted. Now, if you have any questions, you can reach us at webinar@mdpublishing.com. If you've missed any of our past webinars, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and of all the upcoming webinars and, of course, complimentary registration. So thank you once again for your time today, and I hope you will enjoy the rest of your day.
Thanks, everybody.